Okay, so this next demo is for the cervical traction, again with the Triton DTS table. This is the traction apparatus. These are the instructions that are available for your class notes. And I first need to put this piece into the machine. So you have to go in at the top, push it in, and sink it down. Okay? So take it out, it's just the backwards. So top, in, all the way, and then whoop, in all the way, and then down. You can see it gets a little fussy. This is the part which will now traction. So the patient will be placed in here. Now, this needs to be done just so that the patient's comfortable. This is how the strap works on each side, so you can adjust each side. So we'll have the patient put his head here. Let's put a little face paper down. So give me 1 second. We want to have a little bit of cleanliness going on here. Maybe feed it through there. Don't want this to get tangled in the apparatus. And over here. Okay, so to the screen, let's go ahead and look at this. Again, the beginning screen for the Triton. Here's the cervical. Again, there's the traction technique with pictures, rationale with what's traction about, edit is what we need. And it's again the same sort of setup we just saw. Now with the cervical spine, we're not going to do very much weight. It should be 5% of the body weight. So if you have somebody who weighs 180, 5% is going to be 9 pounds. Good thing we have a mathematician here. So we go over here and we'll click this to 9 and enter. Minimum, I'm just going to leave it at 0 because that's a good amount. As I get to know my patient, I may increase that minimum. And change the treatment time to a simple little, again, 2-minute treatment. Enter. And everything is already set. I could change the edit the hold rest times, but the presets work pretty well. So we have set 6 steps coming up, over a minute, no pre-tension. We're going to do an intermittent release and then come back up and then release down. It's been shown that the intermittent seems to release the muscles tightening more so than just static traction. Okay, here we go. So let's go ahead and have the patient get on the table. Let me bring the table a little bit lower for you to lay down. Get onto it easy. And your head is going to go right into here. The occiput will nestle right into this piece here. So let's see how you do. Pretty good. Does that feel good?
Yep.
Okay. Now I'm going to change the width of this so that it's looser or tighter. That's getting looser. Does that feel? Feels kind of loose. How's that? I don't want to crunch your head. It's not Frankenstein. So you think a little bit tighter?
Sure.
We want just enough so that we're going to actually traction you.
Okay.
Is that a good amount? Tell me when.
I think it's good. You can do a little bit more.
Feeling that now?
Yeah, try that.
Okay. And you can always adjust that. If you feel like he's slipping out of it, it can be adjusted. We're going to open up this Velcro here, mess up his hair. Sorry about that. Always have a mirror in your office so you can let the person set themselves up. Is that too tight or is that just right?
Just right.
Excellent. The next part again is a rope release. Pull it all the way out, make it lock, hook it into this little notch right here. Have my finger here, slowly bring it down. Don't want to hurt your patient. And on this dial right here, it will tell me what angle I am doing the cervical traction. Right now it looks like it's at about 25 or so. I can raise the table and change the angle. So you can see how this angle changes right here. I'm going to go up. Okay, let's see. Oops, get my foot on there again. Or I can go down. Okay? So right now I have it in a pretty neutral neck, a little bit of flexion. I can also change this piece here. You're going to feel a little difference now. Down or up, okay, to change the angle of the neck. Is that okay in that position?
Yes.
Right now we're just going to do it so you can see the demo, but you can vary this to your patient. Okay, we are going to go right into this. Let's go ahead and hit start. Table doesn't need to be unlocked because this is our sliding spot. But if your table is unlocked, then the whole body will move. So make sure the table is locked during cervical. It says beep, 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 and here it goes. It's already up to 1 pound. And again, if you want your legs up, do you prefer them down or up?
They're fine.
Okay, so some patients may want to use the lumbar or the leg rolls to keep his low back nice and relaxed. Just make the patient relaxed. Give him a good magazine about health and wellness, and they'll be good. So again, we can see the progression. You're up to 5 pounds. Are you beginning to feel it?
A little tiny bit, yeah.
Mm-hmm. The maximum for cervical traction is 40 pounds, dependent again, of course, upon the body size. We're up to 6 pounds. We started with a 5% body weight starting point. Do you feel it now?
Yeah, I felt it there.
Is it a good feel?
Yeah.
Okay. Again, check in with your patient the whole time. Otherwise, this is an unattended therapy. Whoops, look what I didn't give him. If I was going to leave the room, or even if he's on this table, I probably should have handed him, once again, the patient interrupt switch. And then, once again, I like to put it on the chest so they can just touch their chest to make it stop. Okay, you're at 9 pounds. Do you think that it could be a little higher?
Sure.
Let's show how to do that. So what we're going to do here is go over to edit minimum maximum levels. Change the maximum. Let's go up 2 pounds to 11 pounds. Hit enter, go back, and tell me if you feel the difference. Did you feel it go up a little bit?
I felt the difference, yeah.
Good. So it's pretty straightforward. Patient's comfortable, traction's occurring. I can vary the position of the head, and it should be a very good experience. Now, rather than go through this whole progress, I'm going to, in terms of like going from progression, traction, and then regression, I'm going to demonstrate what happens when the patient pushes the patient interrupt switch. So push that patient interrupt switch, patient. And look at this, it says, warning, patient switch has been pressed, treatment has been terminated, touch anywhere to continue. And a warning sound happens. So you can hit anything and it will stop, and it'll immediately go off all pounds within just 15 seconds or so. Did you notice the release?
Yeah.
Okay, great. Again, getting the patient out is important to do it in a safe manner. You might want to release some of this tension on the rope, just so it is comfortable, and release the patient's forehead region, making it as easy and non-obtrusive as possible. And we're going to have you climb out of this. I can also loosen this up a little bit. I put my finger in there to feel if I'm loosening or tightening, so it's easier. And now I can actually lift him up with the table, or at this point I can have him get up on his own volition. So you want to try that one? Get on off of it on volition. And there you go. Again, the patient should probably get a little bit of muscle stimulation with the hand, just to cause the muscles to re-engage and he doesn't go into any reflex spasm. Thank you.